السلام عليكم. الحمد لله خلصنا ايرور pregnancy bleeding module. ان شاء الله هنتكلم عن emergencies. هتتقسم as antenatal, intrapartum and postpartum. And in this lecture we start with maternal collapse. As definition, maternal collapse is an acute event involving cardiorespiratory system and or brain, result in reduced or absent consciousness and potentially death at any stage in pregnancy and up to 6 weeks postpartum. عشان نقول الماتيرنال collapse لازم يكون during pregnancy and up to 6 weeks postpartum. Cardiac arrest is a final pathway in many life-threatening diseases. Causes of sudden maternal collapse can be classified in obstetrics as obstetric and non-obstetric causes. Resuscitation Council subdivided causes as 4T's and 4H's for ease of memory. In a pregnant woman, eclampsia and intracranial hemorrhage should be added. So 4T's, 4H's, and 1E, which is stand for eclampsia and intracranial hemorrhage as a complication for eclampsia. So causes of collapse: 4H stand for hypoxia, hypovolemia, hypothermia, and hypo and hyper electrolyte disturbance. تمام. Hypoxia include cardiac causes, example cardiomyopathy, MI, aortic dissection, and aneurysm. Hypovolemia, either hypovolemic shock due to bleeding, which is the commonest cause of maternal collapse in obstetrics, or relative hypovolemia in case of septic shock, neurogenic shock, and spinal block. In metabolic causes, the most common in obstetrics is hyponatremia due to oxytocin use, which is used for induction of labor, and in postpartum period to prevent postpartum hemorrhage. Hypo and hyperkalemia, hypo and hypernatremia, even hypoglycemia. One of the causes of maternal collapse and included under the category of metabolic disturbance. 4T's stand for thromboembolic events, toxic, tension, pneumothorax, and tamponade. Thromboembolic include pulmonary embolism and amniotic fluid embolism. Drug toxicity, mainly magnesium sulfate, will be discussed, and local anesthetic drugs. Tension, pneumothorax, and tamponade due to trauma or suicidal attempts, and eclampsia will be the next lecture, inshallah. Hemorrhage is the most common cause of maternal collapse, as we say. Thromboembolism is the most common cause of direct maternal death, and cardiac disease is the commonest cause of indirect maternal death. We're interested in these topics will be discussed, inshallah, as a obstetric cause of maternal collapse. Massive obstetric hemorrhage in a form of antepartum or postpartum hemorrhage, amniotic fluid embolism, eclampsia and magnesium toxicity, neurogenic shock due to uterine inversion. In this lecture, inshallah, we'll discuss amniotic fluid embolism. Amniotic fluid embolism or anaphylactoid syndrome of pregnancy is the preferred term for condition previously known as amniotic fluid embolism. The name change as a manifestation of syndrome is aligned with anaphylactic reaction more than an embolic event. It's a rare but serious complication commonly associated with maternal and neonatal mortality. The last published incidence at 2016 is 1.7 per 100,000 maternities. Survival rate 81% by 2014. Pathophysiology is not completely understood. In pregnancy, labor, delivery, or immediate postpartum period, the passage of amniotic fluid containing elements of fetal origin into maternal circulation. This passage of amniotic fluid triggers a massive anaphylactic reaction and lead to activation of complement cascade or both. Predisposing factors: advanced maternal age more than 35 years, placental abnormalities in a form of placenta accreta and placenta abruption, operative deliveries, induction of labor, abdominal trauma, polyhydramnios, multiple pregnancies, and cervical laceration or uterine rupture. The clinical picture develops rapidly, present as a collapse during labor or birth or within 30 minutes of postpartum period, characterized by four cardinal findings: respiratory distress, altered mental status, hypotension, and DIC, disseminated intravascular coagulation. Seizures and cardiac arrest may occur. There is a maternal and neonatal severely. Short term, the first symptoms to occur are usually dyspnea and cyanosis, quickly followed by acute respiratory distress syndrome and respiratory arrest. Constriction of pulmonary artery eventually leads to left-sided heart failure. This is called cardiopulmonary phase. If a woman survives, it's associated with maternal morbidity in form of encephalopathy, brain injury, and coagulopathy. Coagulopathy is the most common complication if a mother survives, often giving rise to massive postpartum hemorrhage. If amniotic fluid embolism occurs prior to birth, fetal distress develops acutely, and it's associated with neonatal morbidity and mortality. Diagnosis is a clinical and by exclusion of other causes. As we say, it develops rapidly, so suspected when patient is collapsed in labor or shortly within 30 minutes after delivery with signs of central cyanosis. As we say, it's the first symptoms develop in cardiorespiratory phase. Different diagnosis confirmed by postmortem diagnosis. Finding of fetal material in the maternal pulmonary vasculature at time of autopsy in a form of fetal hair or fetal squamous. Management is a primary supportive in a form of generic treatment of shock and coagulopathy. Given the possible anaphylactic nature of the condition, epinephrine use should be considered. This is the end of lecture. Thank you.